I do suspect we're going to see more cases in Canada and the United States. And that's because this monkeypox outbreak is a little bit unusual. It's not something that is attributable to contact with an infected animal or travel to an endemic region, but it's something that's spreading through social networks. And because it lacks some of those prior epidemiological characteristics, we may miss cases. Cases may have the opportunity to spread, and that's likely going to cause more cases to be found in the coming days and weeks. I do think that public health agencies around the world are taking this very seriously and taking the correct actions. You have to remember that monkeypox outbreaks are not unprecedented. What's different is that this is transmitting between person to person without travel history, but it's the same principles of finding cases, isolating them, using the smallpox vaccine strategically to stop these cases from spreading. That's all underway right now. Because of COVID-19, hospitals are on high alert to deal with infectious disease and have become much more adept. We routinely place people into airborne isolation. We routinely use a lot of personal protective equipment. We routinely run down febrile illnesses or fever illnesses in order to figure out what's going on. And there's a lot of contact going on between hospitals and local and state health departments. So I do think that hospitals around the United States would be able to handle this. And remember, it's not the same thing as being having a COVID-19 case in terms of transmission. This is something that can be isolated and dealt with and likely not cause much spread. There's a danger of viewing every further infectious disease outbreak through the lens of COVID-19. And you have to draw distinctions between a virus like SARS-CoV-2 and a virus like monkeypox, which spread in a totally different way from totally different viral families. Monkeypox is a virus for which we have medical countermeasures, for which we've dealt with outbreaks in the past. It's not a novel pathogen, and it doesn't spread efficiently like SARS-CoV-2. So there is a danger of trying to take everything that we knew about COVID-19 and then apply it to monkeypox. You can't do that. These are very disparate infections. And while there may be some synergies in the public health actions that need to be taken, like contact tracing, they're very different responses, very different viruses, and very different threat levels. I do not think monkeypox has any ability to cause a pandemic because it is an inefficient transmitter, because it is not contagious during the incubation period, because we have the smallpox vaccine that is a tried and true countermeasure to stop these outbreaks. Mortality rates, mostly in African outbreaks, have been 1 to 10%, depending upon what strain of virus you get. And these cases that have occurred in industrialized countries like the United States, where we had an outbreak in 2003 related to the importation of African animals, really did not have any mortality and had only a few severe cases, despite 4 dozen cases that occurred. So I think that this is usually a self-limited, manageable illness. And the thing about it is the incubation period is long enough that if you can get to people after they've been exposed and vaccinate them, you can abort that infection from occurring. And I think that this is something that has been on the list of emerging infectious disease. People have been attuned to the risk of more cases occurring. And it's not surprising that more cases have occurred. And although there's a lot of headlines and people are alarmed about this, I think it's more about monkeypox finding the opportunity to spread in a social network rather than something that's changed in terms of monkeypox itself. It's still the same virus. It's still the same tools we use. It's just that it's found its way into a population that has facilitated its spread in a way that it hasn't been able to do in the past.